everybody to the Hair Wire. The Hair Wire, the show where you get hair smart, guys. I know you want it. I know you need it. So this is it, guys. We're here for you. And today is an amazing show. We have an amazing crew here. I want to present my co-hosts here. Bissan, present yourself. Tell the people who you are.
Hello, thank you so much. Sergio is the best host ever in this wild world universe. Really, he just pumps energy.
I'm trying to.
Every single time. So anyway, you guys, welcome to the Hair Wire. My name is Bissan, and I'm a trichologist and a biochemist. I have a master's degree in biotechnology, and I am a functional medicine health coach in training. So if you want to get hair smart, you're going to follow us at the Hair Wire.
Exactly, guys. Also, we have the friendly Kerri Jarrett. How are you doing, Kerri?
Hi, everyone. I'm doing great. Thank you. My name is Kerri Jarrett. For those who don't know me, I'm a certified trichologist and a master level hairstylist and educator. And I also have a business background, and I help mentor many of the people in our industry in trichology and hair and how to transition into the industry. So join us because we have so much to share. We're full of knowledge about hair loss, business, you name it. Sergio?
That's it, guys. For me, I'm a biologist, also certified trichologist. I've been an educator for so many years, and we're here to combine our forces to give you the know on how to treat your hair and how to make the hair the best ever. You deserve your best hair ever, guys. And this is why you're watching the Hair Wire, guys. So today we have an amazing show. Today we're going to be talking about hair loss. But we knew that last time, if you were following our previous broadcast, which I hope, guys, that you're watching our show. And if you aren't, just remember to click the subscribe button, hit the notification bell, and give us a like. That way, our algorithm could start working and more people can get the information out there. So, because we all need it. We all need to take care of our hair. So today we're going to be talking about telogen effluvium, but all the forms of hair loss. So whenever we talk about telogen effluvium, what does it mean to have telogen effluvium? Because a lot of people think that, telogen effluvium is like a dumpster type of hair loss. I was like, what? Yes, because everything that is not androgenic alopecia or alopecia areata, then it's telogen effluvium. So it's a dumpster type of terminology. Is it?
Well, kind of, in a way. It's an interesting way to say that. But yes, like telogen effluvium, basically when it's acute hair loss. Like we have chronic conditions in our health, we have acute conditions. Acute condition, when you break your leg, this is an acute condition. And chronic condition is when a person develops diabetes over time. That's a chronic condition. Same with hair loss. If you have an acute hair loss, means over a short period of time that got triggered from certain thing. And that certain thing could be either infection, could be hormonal imbalance, could be oral contraceptives, could be a sudden change in your diet or crash dieting, could be injury. That sudden change or sudden trigger in your health will trigger a sudden hair loss. However, this sudden hair loss, it is as massive it is. Sometimes it will be so massive. Sometimes it will be a little bit of hair loss. It depends on the how the effect, how big the trigger was, basically.
Exactly.
And how healthy you are, depending on how healthy you are too. But anyway, this sudden hair loss will not last forever.
Thank God for that, because if it lasts forever, unfortunately, we have lots of people that when they go through telogen effluvium, it could last for years. Now, Kerri, walk us a little bit about your experience with telogen effluvium and your clients behind the chair.
Yeah, I see it quite often, and a lot of times clients will come in and experience a high shedding, but because I'm a hairstylist as well, I talk to my clients, so I know their personal lives as well. So as a trichologist and a hairstylist, I have a win-win, because if I know my client and they're coming out to something that might be stressful, or if I know their regular routines, I might be able to prepare them for something that may come up with mass amounts of hair loss, right? So for me, like I see it quite often. And it's with high stress. Most of the time, it's people with a traumatic change or something, a stress trauma. And when it comes to stress, a lot of people think like, oh, I'm not stressed, nothing's going on. Well, as a trichologist who has an epigenetics background myself, I look at 4 stress factors: my intake stress, my environmental stress, my trauma stress, and my physical stress. And I help pinpoint exactly where it's coming from. So I take it to the next level. And I think as a hairstylist, because I have that intimate relationship with them and I'm constantly touching them, they're more open to talk about that stuff. So I do say it quite often. Yeah.
It's interesting how we see so many different scenarios in which lead up to a telogen effluvium event. Now, Kerri, you have a presentation that we want to show our folks here on, so we can go point by point of the different things that are happening to the hair loss, that are causing hair loss basically in your lives. But as Bissan and Kerri has mentioned, guys, whenever we talk about telogen effluvium, we're talking of an event of hair shedding, basically. Now, this event usually starts about 6 to 16 weeks after you have an event, like, for instance, the loss of siblings, fathers, a divorce, something very heavily into the emotional area. Maybe you crashed diet, maybe you had hormonal imbalances. There's so many things. That's why at the beginning, joking around, using the terminology of a trash can type of condition. But the thing is that whenever most specialists don't find a solution to what's going on, can't figure it out, what's happening, usually they will start thinking about telogen effluvium, because there's usually an interruption on the hair cycle. And so we need to find out which type of interruption. So that's what it means at the end of the day.
Well, and I'm glad you brought this up and brought telogen effluvium first, because with the amount of times that I see my clients, and a lot of people don't know what a trichologist is, particularly where I am. And those who don't know, I'm in Canada, Northern Alberta. A lot of people don't know what a trichologist, so they don't know who or where to go. So the first thing they do is they have hair loss, they call their doctor, get in with a dermatologist, or go see a surgeon. Now, the thing is when you have hair loss, a lot of people go and be like, oh, I have alopecia. Well, you guys, there's more than one type of alopecia.
Exactly.
And before you can diagnose or figure out what type of alopecia you have, you got to do an assessment. You got to figure out what it is and go see a specialist that understands the types of hair losses, because you can treat something and cause a worse reaction, cause more hair loss. And so with the telogen effluvium, with the amount of people under stress and the food pandemic, which we've talked about earlier in other episodes, that telogen effluvium is on the rise. So you have people coming in and going for recommendations from their doctors, and they're getting told to take Rogaine and PRP treatments when they may not necessarily need it. And so this episode, we really wanted to dive deep in the different types of alopecia, so you're educated and aware before you start making those decisions and start doing treatments that you do not need, making the situation worse.
I know that many of those treatments are very fashionable, because, everybody wants to do the latest trend thing, what's the latest, what's the best. And I mean, guys, there's no such thing as the best treatment as it is what is the best treatment for you. That's a whole nother thing.
And it's
because
not a one size
the best treatment for the doctor is the one that gives him money. The ones that pay, that's the one that's best for the doctor.
And I want to add to both of you. You said like gems, actually, Kerri. And we started with telogen effluvium for a reason, because telogen effluvium actually it is a blessing in disguise. Because
how come?
Yes.
I agree. I 100% agree with that statement. Yeah.
Yes, because like let us say you didn't have an emergency, an event like Sergio was talking about, but you're starting to have extreme shedding in a very short period of time. That means it's just like God's way to tell you, go figure out something wrong in your body. Then you can do an epigenetic test to find maybe it's a nutrition deficiency, maybe you started a medication and it's not going well with you. It's an indication. Hair is an indication for our insight, and that is really important. That's why trichologists are gems, because trichologists are not only prescription people or only one treatment kind of people. No, trichologists are, as Kerri said, they're therapists, they are psychologists. they make your hair look good. They know the different kind of hair loss. They can relieve your stress. They can be your friend and educate you and take your hand one step at a time to figure out what is the root cause of your hair loss.
Yeah, and I always say hair is an essential biomarker. It is our body's way to communicate with us because we are so busy in this world. We don't pay attention to our own health until we start to deplete, right?
Oh, yeah.
So it's kind of like a red flag saying, hey, my hair's dull, it's breaking, it's brittle, your scalp's breaking out. You got
What is going on?
What's going on? What's it telling you? You're not listening to your body when you have a headache or stomach ache. So now your body's like, hey, you're not listening to me. I'm going to give you a reaction. Oh, you're not listening to me again? Okay, fine. I'm going to make your hair fall out. Now you listen, right? It's a trigger. Absolutely. I'm glad you said that because I tell my clients all the time, like, what is your hair or lack of hair telling you? It's dull for a reason. It's breaking for a reason. It's graying faster for a reason. Why? Let's investigate that. Let's get to the root, literally the root cause of it.
Listen to your hair, guys. Listen to your hair and listen to the hair wire.
Exactly. That's why the hair wire is here. It is a free education for all your needs about hair.
That's it.
Get hair smart.
Get hair smart. Get hair smart.
All right.
We have a presentation. So Kerri, take us away, please.
All right. So I'm gonna load this up. There we go.
Here we go.
All right. Now again, hair loss. Did you know there's more than one type of alopecia?
I don't know why people skip that so much. You know, they think about alopecia and they think that it's just one type of hair loss. I mean, because they're only seeing the hair at the ends, you know, the hair that goes into the drain. And they think that all types of hair loss are the same, and they're not. That's big misconception, big one.
All right, so the first one we're going to talk about, alopecia areata. This one I chose first mainly because I have been seeing this a lot, and I actually have autoimmune disorders myself. I have two of them, psoriasis and celiac. And so I see a lot of people come with me because they know I understand autoimmune disorders through experiential living myself. And you see this quite often, and it's an autoimmune disorder that causes the hair loss on the scalp in parts of the body. So it can happen on your chin, your legs, your eyebrows, and they're patches. Bissan, you want to talk a little bit about that?
Yes. So alopecia areata, as Kerri says, it's an autoimmune disorder, and this is actually we thank our hair to give us a sign. That is a visible sign what is going on inside. It could be worse than just simple area that is lacking hair. It could be even like autoimmune disorders are, it's not my specialty, but autoimmune disorders are very scary one. It comes because we can't actually, it's very hard to treat. But yes, alopecia areata, as you can see here, the hair follicles kind of disappear in a patchy way, and when it comes to the hair, like when it's on the scalp, sometimes it will seen like one patch, sometimes it will be seen like 2 or 3 multiple patches. This is not contagious, guys. Some people think that this is contagious condition, but it is not. The hair follicles themselves weaken to a point that they died, and if depending on the severity or when did this alopecia areata started, it can be reversed. If it is in the beginning of it, when you tame your immunity, when you figure out the autoimmune disorder that caused that part, then the hair follicles, if they're not dead 100%, with microneedling, with some stimulation, it can revive some of these follicles and they come back again. Otherwise, for example, if this part here on a scalp on a lady, scalp micropigmentation is a great solution for that. I perform scalp micropigmentation on patches like this, but scalp micropigmentation cannot be done on a patch that is red or newly formed. It has to be there for many years that we know it's a secretional alopecia already dead. Then we can cover it up, and the lady's hair can camouflage it over that part, and it will be camouflaged nicely. But yeah, this is what I can say about alopecia areata.
And now with autoimmune disorders, like I know it's a lot of people don't know everything about autoimmune disorders, but for myself with it, I found what my triggers were, internal and emotionally. So I know for myself, I could be triggered and my psoriasis will flare up. And so I find with a lot of autoimmune disorders, once you find out where your trigger is, whether it's stress of losing a job, having trauma, or it could be having something that you ate. For myself, I know dairy and gluten is a common trigger for me to flare up. So I go in there with mindful thoughtfulness for my body, being like, okay, is it worth having the cheese? Because I'm going to have a reaction, but you got to weigh it out. And most autoimmune disorders are like that. They have a trigger that will induce it, whether it be emotional or an intake trigger that will cause that inflammation. And it's a matter of just taking that time and understanding your triggers and analyzing you. And remember, guys, it's not a one size fits all world. And I find a lot of times they say, oh, this is your trigger, this is your trigger. But you really have to sit and understand yourself and figure out and kind of analyze your own self and analyze what those triggers are that might be inducing it. So, reverse engineer when things happened. Okay, so we know that alopecia areata takes about such and such time. What happened in that time frame before that might have triggered that? Did you get in a car accident? Did you have a loss? Did you have high amounts of alcohol during that time? What was the trigger? Change of medication. And then you could kind of start figuring out and start making an analysis of what triggers the alopecia areata for you. And it's an autoimmune disorder. It's one of those things that once you understand your body, you could help control it a little bit more. Sergio, what do you have to say about that?
Yesterday, I had a little girl. She was about a year and a half, and she was brought to me from New York. And the thing is, I completed a epigenetic test on her, and her immune response was off the chart. So one of the things that we encountered, that we discovered during the evaluation process, was that she was lacking on vitamin C, vitamin B5, and inositol. And one of the things that the test was showing us, that that little girl should stop eating things like chicken, okay, and grapefruit. I would say, the little fruits that is green.
Grapes?
Grape, yeah, grape, yeah. Sorry, my Spanish starts to kick in, guys. This is an international show, so let me tell you that one right. and many other foods, that little girl should avoid in order to get the immune response into balance. Because you see, with alopecia areata, it's very different for in every case. It doesn't show the same way. It will not show the same type of food intolerance on every case. So it is quite unique. And because it is quite unique, it's very hard to treat on a clinical level. Now, one of the main features that we usually see with alopecia areata is the inflammation. We will start seeing inflammation. So one of the things that we want to tackle into the process is to reduce inflammation and to get the immune system to work with us, not against us. And that is why microneedling is such an important part of a treatment with alopecia areata, especially with kids. I see tremendous growth of hair very fast because we are working to basically doing the key and lock thing, trying to figure out the exact route for each patient. And as we go through the process and we eliminate those things that will not work, then we start adding things that will. And of course, we start getting hair back. So it's an amazing process, but it's very tricky, very hard type of alopecia to treat. So I would say to the people who are watching, do not get discouraged if you have been treating alopecia areata for years. And if you just had it recently, get ready for the ride, because alopecia areata can sometimes be very difficult. About 70% of patients who experience alopecia areata for the first time, they will only see it as a once in a lifetime event, but there's a 30% of them that will see it as a reoccurring event. So you have to watch out for those.
Yeah. All right, off to the next alopecia. Telogen effluvium, which we talked a little bit in here. Sergio, you want to continue on this one?
Let's start it here. Telogen effluvium, as we were mentioning, is a type of hair loss that basically you see as a shedding event. Now, this shedding event can start small and it can grow larger. Usually it happens suddenly, but when it doesn't, one of the main features that we'll see is the diffuse type of alopecia. So we start seeing hair loss in just about everywhere in our scalp. Now that happens over time, but usually it starts with the shedding, heavy shedding, and then over time we will start seeing the alopecia, the diffuse alopecia, starting to form up, specifically on the sides and on the top of our head. Usually the back of the head doesn't get as much hair loss as the other areas on the scalp. One of the other features that we may look for is thinning of the eyebrows. Again, that's one of the features that could be related to telogen effluvium. And as we mentioned before, it can happen because of stress, hormone, diets, medications, lifestyle, even get hit in a particular area. The trauma, a blunt force trauma, can also cause telogen effluvium as well.
Yeah, so it's good to say that we have two kinds of telogen effluvium, either an acute telogen effluvium or a chronic one. So the acute telogen effluvium, it could be like postpartum hair loss, like the one I had after the baby, because of the changing of the hormones, as Sergio was saying, or sometimes when we take medications like oral contraceptives, your body will not will struggle actually to process whatever medication or new medication you are on, and then the sign that your hair will start falling, and it will fall with massive amounts, and it can be freaky at some point. But the good thing that telogen effluvium, as we said before, it doesn't last for long, somewhere between 3 to 6 months, and it is 100% reversible as long as it didn't stay for a long time. So the chronic telogen effluvium, it's kind of the telogen effluvium, like a lot of shedding, but it is over a longer period of time. Also, this is a little bit difficult than the acute one because your hair follicles were under stress for a longer period of time. To reverse engineer it, it's going to take double the time that it took. And again, it is the same thing with all kinds of alopecia. You want to know what happened, what is the trigger. You go fix the trigger so you can reduce the amount of hair loss by time until you at least stabilize it. But telogen effluvium, as I said before, it is a blessing in disguise.
The funny thing is, as we see the hair loss a bit, we start seeing also the thinning as it progresses. And eventually it could also become cicatricial if the condition persists. And that's one of the key areas of it. Now, we see a lot of that during COVID, haven't we, Kerri?
Yes.
Well, we have. And I'm going to touch base too, as a hairstylist, seeing people with telogen effluvium. I often see people go from washing their hair regularly, and then they notice the shedding, and then they decide not to wash their hair as often. And so the hair that they would shed typically starts to build up. And then when they wash it, they're like, quadruple the amount that they would have lost, but it's because they built up the hair shed over the week, thinking that it will not fall out as much because they're not washing as often.
It is quite the biggest mistake, I would say, that people make.
Actually, you mentioned something, Sergio, very important. So after the pandemic we had, the COVID pandemic, actually there was research that I read this morning. 25% of the people who got COVID, who got hit with COVID, got telogen effluvium hair loss.
Yes, it's a big one.
Exactly.
Yep. I mean, people were coming to the clinic with bags of hair, bags. I'm not talking about, little pouches. No, I'm talking about bags,
sandwich
big-time bags. Yep.
Yeah. So the top, I'm gonna read you what the article says. So the top four symptoms of COVID, how you have COVID, is the first one, you have fatigue, headache, attention deficit, and the third one was hair loss, the fourth one was attention deficit. So it was number 3 in the list that you have hair loss as an indication of that COVID that hits you, basically.
And it's tremendous. I mean, you will see it. You will see 3 months later, after you had COVID, boom, you start experiencing telogen effluvium. And I mean, it's not like it's perfectly 12 weeks for everyone, But
Yeah.
most people that I've seen is either on the 6-week, 12-week, or on the 16-week. So those are the basic parameters in which I'm seeing people coming into the clinic after they had COVID. Now, the thing is, how do we treat this type of condition, Kerri? How you treat telogen effluvium? I know that in each case is quite unique, but what are some of the main features or some of the recommendations that we can make generally for people who are experiencing telogen effluvium?
For myself, with people with telogen effluvium, of course, considering the age demographic that they're in, my favorite recommendation is collagen and eating high protein and watching what you eat. So I do encourage people to increase their collagen intake. So broth, what's it?
Yeah.
Bone broth is a really good one, or there is collagen supplements that you can take. I tell them to start increasing and being aware of the foods that they're eating and making sure you're having a good balance of amino acids and fatty acids, and I explain to them how they should be eating. And I know a lot of times too, I know a lot of people are, especially in January, are in weight loss mode, and so they're watching what they eat. And then you're healing after COVID and hair loss, and they're trying to grow their hair, but they're avoiding healthy carbs.
Yeah.
And you need healthy carbs for health production too, because it all works as a system. You need to have your proteins, your healthy carbs, your healthy fats, and a lot of people like cut carbs, cut this, cut that, plus recovering from COVID and hair loss. So I remind them what a well-balanced diet is, particularly for hair loss, because that's our industry. I am going to encourage hair growth. And so I'm going to encourage them with foods like that. So making sure you eat all the foods that are going to stimulate that hair growth. I remind them circulation. So tapping is a big one. I love tapping or scalp massages to get the circulation. And then the next one is exercise. You need to get your exercise. We need to get that heart pumped for 20 minutes a day, because that heart pumping is going to help circulate the oxygen in your blood to stimulate hair growth. And even as tired as you are, you got to push through it. Eventually, it'll just come easy peasy. But I find that is usually a case too, is because after COVID, you're tired, lethargic, yada, yada, yada. But we need to get our system up and going again. And you need to push through.
Me. I mean, after COVID, I've been gaining about 30 pounds or something like that. Now, Biz, let's not talk about weight loss here. What are the recommendations that we can tell our folks generally? What can they do for telogen effluvium?
So the beauty of a cosmetologist who is also a trichologist is he knows that telogen effluvium is it's an acute hair shedding, and that's why in this, usually hairstyling should be a little bit hands-off hairstyling. Your hair follicles are a little bit weak, so I think hairstyling should be put off until this this acute phase passes. And also, as Kerri said, she said it all: your diet, your exercise, and just remember that it's gonna pass, and don't panic, because the more you panic, the more stress you're gonna have on your body. Then it's just a vicious cycle. Just relax, listen to the hair wire. It's gonna be very temporarily, and then it will pass.
And you don't have to cautious of treating something that you don't have to, because the amount of people too, I see it often that they'll go to a dermatologist or somebody, and they'll give them PRP treatments and all these treatments that they do not need.
Let me say
That's
that.
true.
Yeah, let me say exactly what Kerri was saying. At this phase, scalp micropigmentation is a no, because the scalp is exposed right now, but this is not permanent. This is very temporary. So the minute you start doing needles or microneedling or whatever it is you're doing, it's just gonna hurt the hair follicles, make them even weaker. And scalp micropigmentation will not help at this point, because you don't know what's gonna happen when the hair stabilizes. Scalp micropigmentation should not be done only if the hair loss or the hair is stable, basically. And anything, all the PRP, all kind of treatments is actually, it will cause harm than actually will do help.
Yeah, those type of invasive treatments should be at a minimum, if not wait until the hair, the the part where the heavy hair shedding is happening. After that has happened, then we can move on. Usually what I like to say for people when they're starting is, as a small regime, this folks is something in general. So if you're experiencing hair loss and you're seeing a lot of hair shedding, what I usually would recommend is for 30 days. Just try this for 30 days. After that, you go to your regular routine, but try to wash your hair either every other day or at least daily. Why, Sergio? Because we want to remove all of those hairs that are already been falling out, that the follicles has already pushed out, and we want to remove them. We want to remove them to make way for new hair, because by cleansing the follicles, we increase the absorption of nutrients, and we are also helping with the blood circulation and the removal of waste. So if we start by simple washing your hair, use your shampoos, use your conditioner, use your leave-in conditioner, your mask, your oils, whatever treatments you have at home, use them, but use them in a fashion where for the first 30 days, you will use it at least daily, and you will start seeing that by the second week, usually, you start seeing a reduction in the amount of hair that you're washing on daily basis. In the first 2 weeks, you will see, oh my gosh, tons of hair.
Yeah,
But by the third week, you will start seeing that that same amount is being reduced on daily basis. And now you're seeing, oh, well, Sergio, yes, I'm still seeing shedding, but not as much as on the first and second week. And that it's important that then after 30 days, then you start spacing it out every other day, every 2 days, at least twice a week, folks. So it will help you into the process. But when you're starting with that heavy shedding, I will suggest to try this. And if it start working for you, then you start moving to the next phase, where is stimulation, and we can start doing other things as well. But again, this is very complicated. It's not a one size fits all type of thing. So make sure that whatever is going on, you understand what's happening, and you're working your steps to get better.
So you guys, androgenic alopecia, we talked about it like in our second episode, you guys, right?
Second and third continued,
Yeah.
So, but for those that didn't watch, just briefly, let's talk about it, and then we can tell them to go watch episode 2 and episode 3, because it is rich, full of information and treatments and all of that. But basically, for here, Bissan, you want to?
Yeah, so androgenic alopecia is like, as if people say, call it male or female pattern hair loss or pattern baldness. It will affect basically 50% of the population. And it has two parts to it. One part, the first part is hereditary, where we inherit the gene that causes hair loss, or androgenic alopecia. And the second part of it is genetic, where sometimes there's a trigger that happens to your life, and not triggers are not couldn't be that acute, like the telogen effluvium. It could be as simple as one nutrition deficiency or nutrient deficiency. So it will affect the male and female equally. For females, it will be like widening of the part, and for males, it will be the receding hairlines and the vertex thinning. But both hereditary or genetic hair loss, they're both together called androgenic alopecia, are relatively the easiest types of hair loss that can be treated, especially if we catch it from the beginning. And we talked about a lot of that treatment. Go to episode number 2 and 3.
Yeah, guys, go to the previous episodes and watch, as we talk plenty about androgenic alopecia. But again, as a reminder, is basically when you start losing hair on the top, for shorts.
Yes.
And of course, there's many ways that we can treat androgenic alopecia, but we have to be mindful of, the stress, the diet. We can start work there. That's the first place where you want to work. And then we start working with DHT blocking and other techniques to help promote hair growth at the same time that we are keeping the hair, which is very important, guys, to keep the hair. Now, I want to mention something about androgenic alopecia and, of course, about hair surgery, hair transplant surgery. Hair transplant surgery is not the first option, guys. It's not. It's the last resort. And I see a lot of people getting hair transplant like crazy. Actually, today I saw a video of a young guy had hair transplant and the harvest area was completely destroyed. I mean, it was a bad surgery from the get-go.
Is that the one where they put it in incorrect too? They had the follicle facing in the wrong direction?
Yep, that same one.
Yeah.
Yep, that same one. I think you posted that one.
Yeah, I shared that with you guys. The poor candidate went to Turkey, got hair transplant surgery and he got it young before he was even a candidate if he were to be anywhere else. And they pulled it from it's yeah, it's a heartbreaking case. And the thousands of dollars he has paid. So you gotta be very careful, which we do talk about that in the YouTube videos, episode 2 and episode 3. Go check that out. And as well too, Bissan talks about 2 new cutting edge treatments. Techniques. One of them is Botox. So go check that out. Then we're gonna go to the next one because if you guys, we want you to watch our videos, go watch it. All right, Sergio, you want to take on this one?
Yes, let's talk about cicatricial alopecia. Now, there are many types of cicatricial alopecia. I like to always direct my customers who are experiencing any form of cicatricial alopecia to the Scarring Alopecia Foundation. It's an excellent website, scarringalopecia.org, scarringalopecia.org. And it's an amazing place because you will find basically the different forms of scarring alopecia, and it will show you different types of treatment that your doctor could prescribe during the process. Now, as trichologists, what can we do to treat cicatricial alopecia and what it is cicatricial alopecia? First of all, whenever we talk about cicatricial alopecia is when the follicles die, basically, and that space becomes filled with collagen and cicatricial tissue. And of course, what happens is that the follicle will no longer be able to produce new hairs. And that's the important part of it. It's unreversible. So because you cannot reverse it, you have to treat it early. You have to do the best that you can to keep the follicles at place, keep them working, and some way you are able to at least reduce the area by, if you have a follicle, a working follicle who's only producing one single strand, maybe you can upgrade it to 2, 3 pieces of hair per follicle, and that will increase the area, that will make the area look greater. Also, increasing the diameter of the hair strand will make it look fuller, even though it's the same amount of hair. So there are very different techniques that we can implement into the process to help people who are experiencing cicatricial alopecia. Now, one of the things that happens here is that, again, we have the immune system working against the scalp. And again, we have to stop that immune response. We have to work with the inflammation. And for that end, we are able to stop the hair loss. And of course, later on, we can start working with other techniques to help the area improve.
Mm-hmm. I can add that scalp micropigmentation is a perfect solution for cicatricial alopecia. Yes, especially if there's enough hair to cover up the dots. Then, because cicatricial alopecia, as Sergio said, that the follicles are already dead. If it is started maybe like if this picture, like how we see it, maybe some of these follicles are not 100% dead yet. So these can be revived by stimulation or microneedling or so on, but not the whole area, because if it has been diagnosed as cicatricial alopecia. And also, again, we have to know the root cause.
Yeah. That's one of the hardest part of it, understanding what caused it. And treating that inflammation is very hard for sometimes.
Yeah, especially the traction alopecia. It's when ladies put her hair in a very tight like hairstyles, then the pressure on the hair follicles, the continuous pressure on the hair follicles will make it weaker and weaker until it dies. So the awareness, the education that we spread here over in the hair wire will let you understand that we shouldn't go to that far where the hair follicle become dead, because if it's weak, it can be revived.
Yeah, and I'm going to touch base from the hairstylist perspective too, because I see this quite often, and I am a huge advocate. And those who are in the hair industry that do follow me, I also go as Kerri Jarrett in the hairstyling industry. I've been a huge advocate of education and making sure you understand if somebody is certified, licensed, or trained, because there's a lot of our industry, especially depending on the state or province that you are, where things aren't regulated. So applying hair extensions or opening up a quote unquote licensed salon and practicing licensed services when you need to have a business license and a license in your industry as a barber or hairstylist. And a lot of people don't realize that. And so I see often where people go on Kijiji or Facebook and they find somebody doing hair extensions in their area and they're not trained. There's somebody who just decided to get up and be like, I'm going to apply hair extensions, but they're applying them incorrectly, causing follicle damage. And until you understand how to apply them properly to prevent things like traction alopecia, or even doing chemical burns. I've seen with Brazilian blowouts, a lot of people with chemical burns. I have one client, we're working on a lawsuit right now because I do investigate some stuff to confirm if it's scarring alopecia for people. But she had somebody put a Brazilian blowout, which is illegal here where I am, put it on and left her.
Whoa.
To go home and wash it out herself. And she has severe chemical burns. I have another young gentleman, which I've been helping with. He went to a licensed barber in a town just outside in another province from here, and he's coming to see me now. And the barber used unsanitized barbering tools, caused a fungus on his scalp and caused a permanent scar on there, and it was because he didn't sanitize his tools. And a lot of licensed people were trained to sanitize, we're trained to clean all this stuff. And so it's very important for you to also understand where people are educated in doing what they're doing too, so we don't cause permanent damage, right? So I see it quite often. I'm a big advocate of being aware, and you have the full right. You have 100% right to challenge and ask somebody about their education. Were they trained? Maybe it is education that they've been passed down, which I'm a firm believer of apprenticing under, like, you know, if you're you grew up in a salon or your aunts were hairdressers and you grew up an apprentice as somebody, yes, that's the same education. But say somebody just decided, oh, I'm going to do hair today and start applying extensions without having any previous experience from being passed down from, say, their mom or their grandma or their dad, or actually going to school for it. That's totally different. So you have all the right to ask. You can also ask for any other certificates if they are approved by, you know, their local city with a permit. We have to have an inspection to make sure that we are sanitary to open. You have the full right to ask for that, and especially when it comes to things like chemical burns or straight blading and all of that. So
very important stuff. Very important, guys.
All right, next one. All right, so we went over the 4 major types of alopecia, but these are other common ones that we see when we break down. I just wanted to put these in here because we see this quite often, and I don't know about you, but me in my chair, I'm seeing a lot of people with trichotillomania.
Yeah. So yeah, trichotillomania, it is because of the stress that after the pandemic, actually, that happened for a lot of people. I saw a lot of people who are suffering from trichotillomania. And it is not only picking up on the hair. Trichotillomania means that person will pick up on the hair without themselves aware of they are doing that. And it is just a response from their nervous system. Sometimes it will be for guys on their, you know, beard hair, or sometimes it will be hair from the scalp or the beard, or even hair body. And this is very sad in a way, because the only solution for that is mental health. And these days, mental health is a big issue after all what we went through the pandemic, and a lot of people lost their jobs or loss of dear ones. So this is need a psychiatric treatment, or just managing your stress with all kind of stress management that available.
Yeah, like you could see even a life coach or somebody who can understand with empathy and sympathy. I do see quite often, I have a few clients with trichotillomania that I see. I have a life coaching background too, so I do help and consult with people and work with the psychologist as well for a lot of these people that I talk to. But often, and I've heard hairstylists even saying this, well, just stop it.
Oh, you
Just
can't.
stop it.
You can't.
You
It's
can't.
You can't.
No,
It's
no,
an
no.
envelope.
It's not
Actually,
right.
sometimes these people are picking on their hair without even knowing. They don't actually know. And it's
Most
an
of the time they don't
involuntary
know. Yep.
nervous system.
Yeah.
Nervous response, sorry.
Yeah, myself, like I notice sometimes my husband catches me. I have, I can't say dermatillomania, where you pick the scabs on the back of your neck when my psoriasis flares up, and I don't know because I'm nervous. So he knows that I'm nervous because I'm in there picking, but I don't even know I'm doing it. But now when he noticed, he's like, Kerri, what's triggering you right now? I'm like, oh, yeah, I guess so. And little things, even driving on the highway, I'll do it.
Yeah, you're nervous.
You don't know.
Yeah.
No, that's the problem with trichotillomania. I mean, it's part of the family of OCDs, obsessive compulsive disorders, and to treat those guys, you should visit a psychologist or psychiatrist who specialized in OCD. Now, the treatment it's quite challenging because it's about behavioral changes, and most of the time if people are not aware of them, it's very hard to change that type of behavior, if we may again. But the thing is, it's treatable, but people need to be willing to help out into the process. They need to really be engaged and be willing to accept that they have a condition, even though they don't understand that they're pulling their hair. Usually when we see that with the microscope, we see the way their hair breaks because of the length of the hair breakage. Many people will come to the clinic and they will say, oh, I have alopecia areata. It's not the same. There's very few traits, very few characteristics that we can pick up and identify. This is not alopecia areata. This is trichotillomania. You're picking your hair. You're pulling out your hair. No, I'm not. The evidence shows the contrary. So we need to let people into the process and let them understand that this is what's happening. It's normal. We can work it out. Take it easy. Be calm about it. And specifically with parents and kids, it's not like you're gonna be hitting the hand every time. That you're not gonna change the behavior because you hit the hand. What's gonna happen is that the kid is gonna hide into the room and they're gonna be pulling their hair out. So there are ways to treat it.
They feel shamed.
Yes.
Yeah.
That's the thing. That's the
you
thing.
Can't bring it to attention like that.
Exactly.
There's
you guys are parents. You know what that is.
Yeah. That's really hard. Yeah. But there's two things that I heard about. I don't know how effective they are, but there is a band that they wear, and every time your hand goes up here, it shocks you. And then you will, oh yeah, okay, I'm not gonna do that anymore.
Yes, that's right. I know the band you're talking about. I can't think of the name.
I forgot, but I heard about it one time, and I never saw any client who used it in front of me, but I heard about it. And there's another one, like where the patch, where usually when they pick on one particular area, either here or here, wherever the area is. Then you put a fake skin over it, like a kind of barrier. So when the cosmetologist will put it for you and maybe glue it gently, of course, you don't want to do traction alopecia, but like you put it where, so when they go there, because it's a habit, then there's nothing to pick. So by time they will unlearn the habit of picking. And the last and most important is compassion. For this.
When I was my most stressed during college, when I was at school, my coworker, she put micro links, because I always do it on this side right here, and she put micro links. So every time I'd go in there, I felt them like, oh yeah, okay. And cognitively I started training and being like, no, stop. And I never switched. It was because it's always this hand, and it's picking the skin. I'm not picking the hair, so I'm causing scarring alopecia on the back of my neck. And I found with that, it was just kind of like that reminder, like, you know, when you go bite your nails and you put the nail polish, it tastes gross. But instead here, I felt the beads. I was like, hey, no, I don't want to do that. I'm good.
Yeah, that's a very good way. That's a very smart way to do it.
Yeah, and it worked. I still do it once in a while, but not as bad as I used to. Like during exam time. Yeah.
It's a thing, you know, it's dealing with the stress that causes it. You know, there are specific triggers to it. And, you know, that's why we need a psychologist to help us understand that.
Yeah.
All right, let's go on to the next one here. We talked about this in scarring alopecia, but traction alopecia, this is a very common one we see. I often see too, another we didn't touch base on, in the 80s, remember when women used to tease the heck out of the top of their hair?
Big hair time.
I find that also too, a lot of the women now who wore their hair like that have follicle damage, and it's quite thin in the spots that they used to tease. And it was because of the high amounts of alcohol hairspray that build up the clogged follicles and then the hair teasing. And that's a fun one. I could get that age demographic. I'm like, were you an 80s kid?
we are kind of 80s kids, so
or 80s teenager. Were you an 80s fashionista?
So guys, about traction alopecia, one detail that we need to understand here is, you know, if you're pulling your hair too much with the hairstyling, is gonna fall off. Simple as that. So you need to cut on those pulling type of hairstyles. I mean, I have many people, they live with their ponytail. They love their ponytail, and they love it so much, pulling their hair so tight, and you will see a band of hair loss all across the frontal area, and even from all the borderline, all the perimeter across the scalp. And, you know, the only way that we are going to be able to deal with this is by people stop pulling their hair. It's as simple as that. People need to stop pulling their hair. The same thing with braids. And we have people with, they love their braiding and they look beautiful. But if it's too tight, it's too tight, and you need to loosen it up, man. You need to loosen them up. And until you do that, then we will only be seeing hair breakage and, of course, follicular damage across the area. So,
and there's another one which we don't talk about too often, but even wearing baseball caps and bandanas. My husband was a trained chef for many, many years, and chefs often are wearing the bandanas, and that causes traction alopecia too. And so to be aware of that, and I get asked that question of often with helmets, hats, bandanas. Yes, that can cause traction alopecia because it's the friction constantly rubbing on that scalp. So is there ways that you would recommend to prevent that? Because I know that's going to be asked.
I mean, for guys, specifically with the hat, you know, they have the hat, and I will say, once you place your hat, place it, you know, make it loose enough so that whenever you shake your hat, you're not pulling your hair. But if it's too tight, then every time you shake your hat, you're gonna be pulling your hair. So, you know, wear a hat, you know, to be loose enough so that you're not pulling your hair. And if you cannot wear a hat a full day without shaking that thing off, don't wear a hat at all.
And also the type of the material, because these hats are made from nylon, you know. And
it will depend on the hat. I mean, I'm not a hat guy or a cap guy. I never am. But, you know, every time I wear one, you know, I will wear it for about an hour. I will start feeling the heat, and I will just remove it because you just can't have it. But there's people who love their caps, who love their hats. And, you know, it's okay. You can wear them, but please, there's a limit to it, man, because you're gonna be pulling your hair out. As simple as that.
And clean them too. I find a lot of people, especially like if they're wearing hockey helmets or the hard helmets, and then they get, you know,
Oh,
rashes or
sports guys. Those
anything.
are the worst. Those are the worst. They don't
Yeah.
clean it up.
Yeah, clean that with alcohol. You know,
Yeah.
take a makeup pad, get some makeup pads with some alcohol, clean that area. I know there's a lot of great videos on how to clean your baseball caps. We put my husband's in the dishwasher. Like there's a lot of great ways that you could clean them, but you don't want that bacteria buildup to cause a fungus that again will lead into more issues. So yeah.
There's a complete culture of fungus in there. Those things, guys.
Oh yeah, that's like a community.
You gotta clean them up. You gotta clean them up.
All right, another one. This is one of my favorite topics, obviously, because I'm a hairstylist, hair fiber conditions. I work with hair regularly, so hair fiber is something I'm always analyzing, especially with hairdressing if it's been over bleached, over processed, but also too, I could pinpoint on hair too if you've had recent diets or if you're malnourished or if you're stressed. I might see your gray hair go quite fast and come in quite fast or dry or dull, and I could tell a lot. Like if you have very dull hair, I might consider and ask you maybe you're a little malnourished. So hair fiber is a big one. That's seeing split ends, breakage, dryness, dullness, oiliness. I don't even have that on there. Frizziness, like it's all of that. I could talk about hair fiber all day.
And in trichological terms, even the terms we can't even sometimes say them. Trichonondosa, and like so many trichological. Yeah.
Yeah, we'll try and put them in layman's terms because we can't say them, and sometimes
Yes,
it's as simple
really
as
hard.
a split end.
Yeah, it's really hard. Trichonosa, I can't even say that.
Now, the thing about hair fiber conditions is we need to separate. There are two types. Okay, we have the congenital type, and we also have the acquired type. So we say that again?
Yeah, say that again.
All right. So in terms of trichological terms, in trichological terms, guys, we have two types of hair fiber classifications: the ones that are acquired and the ones that are congenital. Now, on the congenital side of things, basically you were born with it, with a deficiency that naturally makes the hair brittle, and it will break, it will freeze, it will split. Basically, you can try to improve over time the quality of the hair, but that is something that you're going to be living for the rest of your life. Now, for most people, it's all about working with excessive heat, excessive chemicals, excessive traction, the type of hair brush or hair tools that you're using, and of course about environment, the type of water that it's running on the pipes that goes to your house. Is
Even
it hot
temperature,
water?
temperature too.
Temperature runs big time. I know people like to wash, bathe at hot water, but hot water like enough to boil. I mean, you want to cook your hair? Is that the thing? You don't want to cook your hair. I mean, you want to bathe. You want to wash your hair. So it has to be at a temperature that is comfortable enough. And the final and main area will be nutritional deficiencies. Now, many people don't think about nutritional deficiencies as a way to affect the hair fiber, to increase hair breakage and things in that order. Now, I want to leave that to Bissan because Biz, this is your area of expertise right now. So,
well, yeah, I mean, if you run and you guys both know that if you run an epigenetic test on your hair, you know exactly what the deficiency in the body is. And whenever there's hair fiber disorder, means that it beyond even nutrition deficiencies. It may be like a couple of factors. Maybe it started with nutrition deficiency, then it coupled with the bad styling habits, it coupled with, as you said, temperatures, or even sometimes I feel that sleeping on harsh surfaces also may break your hair, especially if you have fine or thin hair. That's why if you sleep on like silk pillows will actually help prevent any dryness in your hair fibers, because even 100% cotton pillows that we all used to sleep on, it will take the moisture out of your hair fiber, and it makes it dry, and it will encourage the breakage. It will encourage the split ends and the dryness. So as always with hair, your hair will tell you what is going on with you, and in a way that that simple test with epigenetic tests, you can know. And if you go to a hairstylist who actually educated about these hair fiber conditions, she can help you, because overstyling is not good. Overdoing anything is not good. So especially with the acquired one, the congenital one, maybe you can work from inside, but the acquired one, actually, I think the acquired one is a bit easier than the congenital one, because the acquired one, you can stop the habit or at least reverse it. But the congenital one will be a little bit harder, because you have to dig deeper inside to know what's causing it.
Now, about treatment options, Kerri, people like to think, trimming the hair will be the only thing that you will need. Is that right? Or what else people need to understand about hair fiber conditions and how to treat it?
Yeah, well, hair fiber treatments, definitely cutting and maintaining that is a key one, mainly because once you get a split end or breakage, the only way to get it out is to blunt it off and not trim and still have that split in there, because it will just travel and create more damage. It'll travel up the hair shaft. And you can do treatments, but a lot of times people go get treatments, but they'll over treatment. So they'll do protein treatments. But when you do protein treatment or keratin treatment on top of each other over and over, eventually it becomes brittle and breaks as well. So there's a lot of things that you got to keep it moisturized. Maybe if you are where I am in winter, I have to have more oils and serums protected than I do in the summer. Like, there's a lot of factors to consider. Like, this could be a whole 3-episode discussion, this topic, but there's a lot of factors. And a lot of times people are like, oh, I don't cut my hair, I'll just let it grow. Well, the thing is remember, our hair is like a tree with bark. Every 1/4 of an inch is a month behind us. So if, say here, I go back so many inches, that time period, say that was 2 years ago, I went on a specific diet or I took a specific medication. Well, the only way for me to get that out is either to maintain it while it's being brittle, so that way it doesn't break more, or cut it out and let it grow out, because that's in there until it's cut out. There's nothing that you can do. You could put a Band-Aid on it to maintain it, but it's not going away until that's cut out, because it's in the hair shaft. So yeah, there's a lot of things like hair fiber. I could talk about this all day.
Let's do an episode on that then.
Yes, we can.
Yeah, let's do an episode on hair fiber conditions then.
We need a full episode on this. We need a full episode on it.
And my favorite one, I'm going to share one trick though with you guys. Like, one key thing to keeping beautiful shiny hair is balancing the pH. And I find a lot of people don't use serums enough. Even if your hair is dry, brittle, broken, everything, you could still, serums and keeping that pH balance is the key to everything. And now, with that being said, I find a lot of times people will have long hair and they think to keep it safe is put it wet in a tight bun or a tight braid. Well, the thing is, our hair has more elasticity when it's wet, so it'll stretch.
Yep, it will
so next time you're in the shower, take your hair while it's wet and see how far it stretches when it's wet and when it's dry. And so when they go and put their ponytail in, and I see this commonly people with long hair, and they're always like, my hair has so much breakage, it split ends. And I always see in the back of the head in the one patch where they would have a ponytail or where their bun would be turned around. And I'd be like, yeah, you wear your hair in a wet bun. And like, how'd you know that? Do you follow me? I'm like, no, your hair's telling me. And it's because they'll put their hair in a tight wet braid at bedtime or a tight bun. And then when it starts to dry, what happens, the tension, just like a rope, it will eventually snap.
Yep.
And once you get split ends, once you get split ends, they fork together, and you've got forks together. They get stuck, and then you pull them more, causing more split ends, and it spreads. Just like, when your kids play with glitter and glitter gets everywhere. That's the same with the split ends. Same thing. And those are hair fiber issues. And a lot of people don't realize, like, well, I'm doing everything I'm supposed to. I'm using the conditioner. I'm brushing away I'm supposed to. I'm like, yeah, but you're putting your hair in a wet ponytail.
Yeah. And also sometimes we do two things we don't get, like, we are not aware of. We brush our hair very quickly, tick, 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 because we're in a hurry.
That's like chalkboard sounds for me.
Literally.
I know. And the second thing is how you dry your hair after the shower. Like, you cannot bring the you cannot do that.
Yeah, you can't take the towel and shake your head. You can't.
Yeah.
It has to be tapping, 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 using microfiber towels, not harsh towels, you know.
Or a cotton shirt. Cotton shirt. Go to Value Village or your local thrift shop. Get some old cotton shirts. Those are the best for absorbing moisture out of the hair, especially for people with fine wavy hair. Yeah.
Yep.
Yeah.
Also, one of the things with hair fiber condition, guys, it's conditioning. You have to condition your hair. Now, many people, when they use a conditioner, they will only leave it for about 30 seconds and remove it. You have to leave it at least 5 minutes. At least 5 minutes.
They're getting better. They have one. I'm not kidding. I'm going to endorse it because it's an amazing product, Milkshake. They have this super 10-second deep conditioner with glycerin in it. I'm not kidding. It is literally put in for 10 seconds and it does its trick. I've never seen anything like it.
As long as it works, I need to see that. I haven't seen that one yet.
It's a magic potion. Oh my goodness.
All right.
But with conditioner, it's also using the conditioner for your hair type and for the season. So like all my clients, because we have a harsh summer, we have a harsh winter. So I make sure they have the right one for the summer, they have the right one for the winter. And so for winter, if they're doing conditioner, I tell you only from the shoulders down until your hair until you're able to comb your fingers through the hair, essentially, like until it feels like it's nourished and it's absorbed a lot of that. And then rinse it out and try to rinse it out with cooler water. Because what happens is when the hot water is on the hair, the cuticle swells and opens up. But when you put the cold water, it shrinks. And so it hugs it into there. And so that's why you're using the cool water to rinse out the conditioner. So, and even if you don't want to go under, like in the conditioner, you're only putting it from mid shafts down. Unless you have a dry scalp, I will put like a daily conditioner on my ends and then a heavier conditioner on my end, or a daily conditioner on my roots, and then a heavier conditioner on my mid shafts to ends to balance pH. But the whole point of conditioner is to help detangle and balance the pH of the hair.
And one more point here, if you put the heavy conditioner on your scalp, they are big molecules, they're very heavy. It actually makes your hair very, like, it doesn't give it volume. It makes it looks very thin.
You look greasy.
Yes, thank you. That's the word I'm looking for.
And that is why you guys are watching the Hair Wire to get hair smart. You're getting hair smart today, right now, guys.
Exactly.
Okay, we got to move on to the next topic because I will be here forever.
All right, we got about 3 minutes left. So you tell me, Kerri.
Scalp conditions. We need to talk about this one real quick because we as trichologists also see scalp conditions quite often. My favorite one with scalp conditions is I always have people coming in saying they have dandruff when it's a dry scalp. So it's knowing, Is
it really?
Is it really? So as trichologists, we see a lot of scalp conditions, psoriasis, eczema, dermatitis, folliculitis, fungal, we see it all. But as where I am, I see dry scalp and dandruff all the time. And oftentimes you have somebody coming in with dry scalp and they self-medicate, thinking they have dandruff, causing dandruff.
Mm-hmm.
Because that's the thing, whenever they see flakiness, and they relate that to regular dandruff, dandruff shampoos are going to make the scalp even more dry and you will start seeing even more flakiness. So it's about, turn it sideways, so do the other way around. And, please visit a trichologist, friends. Visit a trichologist. Visit to thehairwire.com, go to our website and see where you can find good trichologists in your for you. You have right here 3 trichologists. We have Canada, we got Florida, we got Puerto Rico. So choose one. Choose one, and visit a trichologist, guys. Even if it's online, we offer online services right now, guys, so we can help you out and identify properly what's happening to your scalp. Now, Biz, let's talk about scalp conditions here, please. What's happening?
Can I interject real quick?
Please.
We are working on the website. The website is a work in progress, but there is a geolocating map that we will have eventually. So right now, if you want to talk to a trichologist right now, you could talk to us and we do virtually, but eventually we'll have a geodirectory map where you could go pinpoint a trichologist that you want to see in person, that we endorse and say that we vouch for them and they are certified, then you could go to them in that area. So if you do know any trichologists or a trichologist, help us populate that geolocation map. Once we get that going, it should be up live by next week. Fingers crossed. Sorry, Bissan, to cut you off.
Oh yeah.
And you guys, you have 3 languages, not English. So you speak Spanish, I speak Arabic, and Kerri speaks French.
Oui, j'ai parlé
So-
français. Oui.
Exactly.
También
So
español.
you guys can just go and have put your questions underneath each episode, and we will be happy to address it the next episode. Because now we're running out of time, but scalp conditions can be a one full episode with all the pictures, and we can discuss it one condition at a time. But yes, you need to understand what kind of condition. It is not dandruff all the time. There's even psoriasis, there's eczema, all kind of seborrheic dermatitis is a big one too, especially here in Florida with wet weather. But anyway, ask us questions. Just put your question in the comment, and we will get back to you, even in Spanish, Arabic, or French. And stay tuned in the hair wire.
Now, again, you guys, why do you need to get an assessment? Sergio, take me home.
Easy peasy, guys. You need help, because if you're going to educate yourself, you're going to take years before you figure out what's happening to your hair. Also, if you're not doing it already, you are spending too much money trying to find out a one solution. You're not going to find a one solution to your hair. What's going to happen is you're going to find something that will work for a little time, and then you're going to go back again to what's happening to you. So if you will really want to stop it, the shortest route right now, visit a trichologist. Let's find out what's happening to your hair, what's happening to your scalp, and we will develop a treatment plan that will move you forward through the different stages until you get right.
You know why I love trichology? As you know, I was working in scientific labs as a researcher for a long time. But all diseases, strokes even, they're acute diseases, or chronic diseases, every person says, first thing they say, my hair.